So far, more than 4 billion vaccine doses have been administered globally. More than 80% have gone to high and upper middle income countries, even though they account for less than half of the world's population. I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
Dr. Mariangela Simao, Assistant Director General.
We need an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. Accordingly, WHO is calling for a moratorium on boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. To make that happen, we need everyone's cooperation, especially the handful of countries and companies that control the global supply of vaccines.
Simultaneous translation into 6 languages, Portuguese.
It's no understatement to say that the course of the pandemic depends on the leadership of the G20 countries. 1 month from now, the G20 health ministers will meet ahead of the G20 summit in October. I call on them to make concrete commitments to support WHO's global vaccination targets. We call on vaccine producers to prioritize COVAX.
Back to what Dr. Tedros just said.
What we're calling for is, for at least the next 2 months, is a complete, global solidarity around the goal of catching up the rest of the world to, in terms of its immunization coverage. So the moratorium is all about, for those who've decided that they may want to use booster doses, et cetera, trying to put a hold on those policies until and unless we get the rest of the world caught up. Because we have to approach this, as the Director General has said from the very beginning. We're in a pandemic. The entire world is in the middle of this, and as we've seen from the emergence of variant after variant, we cannot get out of it unless the whole world gets out of it together.
Administer a third dose, a booster dose.
This is a really big decision about administering third doses to people who have already been vaccinated. And it's incredibly important that we're clear about what the data are, that the data are strong in supporting or in not in support of whether or not those doses need to be administered. If we're not really grounded in that clarity, we're going to be in a place where we have forever uncertainty about what actually should be done.
Brian mentioned, for COVID-19,
with more transmissibility of the virus, the need for a greater proportion of the population to be vaccinated in order to start to provide some herd immunity is needed. So this is a number that continues to be something of interest. We know that it's going to be a value, a proportion vaccinated that's going to be substantial. And those are really sort of questions that we can continue to look at. But what's very clear is that we should be advancing the vaccine program in all countries to get well past where we are right now.